Welcome to our deep dive today.
Yeah.
We're going to be looking at all the news from January 22nd, 2025.
Sounds good.
So much going on.
Well, it is.
I guess let's just jump right into it.
Okay.
A lot happening in politics and healthcare.
Right.
Former President Trump
Oh, wow.
back in office
Yeah,
and already making changes
of course.
to healthcare, reversing a bunch of Biden's directives on healthcare,
Like where?
stuff with the Affordable Care Act,
Right.
and AI in healthcare.
That's interesting.
Isn't it?
Yeah.
I mean, his administration
Okay.
is also backing a major AI infrastructure initiative.
So they like AI, but they're a little wary of it in healthcare.
Exactly.
Okay.
And on top of that,
What else?
he pulled the U.S. out of the World Health Organization.
Again?
Again.
Wow.
So we included a fact sheet
Okay.
for everyone listening.
Yeah.
It details the history of the U.S. and the WHO.
All right.
What do you think about all this?
Well, I mean, global health challenges really need global cooperation.
Right.
So the U.S. pulling back could impact funding research collaboration responses to new health threats.
Yeah.
It's uncertain,
Yeah, for sure.
which is not good in the health field.
Speaking of uncertainty,
What's that?
AI.
Oh, yeah.
It's everywhere in the news today.
It is.
Like a double-edged sword, I guess.
How so?
Advancements and then like serious questions.
Mm.
Google DeepMind,
Yeah.
their CEO predicts AI-designed drugs will enter clinical trials this year.
Wow.
AI making our treatments.
That would be amazing for diseases that don't have effective treatments yet.
Yeah.
But what about safety?
Exactly.
And the FDA?
Right. How are they going to adapt?
Tough questions.
Then there's this Novo Nordisk executive
Okay.
saying humans aren't always necessary
What?
when it comes to AI.
Really?
He compared it to
Shoot.
scribes becoming obsolete.
Because of the printing press.
Yeah.
I see his point.
Do you think doctors and nurses could be replaced by AI?
I don't know about replaced,
Okay.
but it'll definitely disrupt things.
Right.
Like the printing press AI can automate tasks, analyze data, assist with diagnoses.
Right.
But empathy, trust-building, nuanced understanding of human behavior,
Yeah.
those are harder for AI.
Makes you wonder if med schools are preparing students for this.
Yeah.
Speaking of which,
Well,
some med schools are using AI to screen applicants.
interesting.
It's supposed to make things more efficient.
I guess, but is it fair?
Good point.
AI bias is a real concern.
Yeah.
Are the algorithms truly objective?
Yeah. Are they just replicating existing biases?
Exactly.
We might need AI to monitor AI.
Right.
And on the economic side,
Yeah.
people are worried about AI's reliance on cloud computing.
Costly.
Increasing healthcare costs.
Makes sense.
Maybe hybrid models are the answer,
That's what some are saying.
using cloud and on-premise solutions.
Balance the costs with security and control.
Seems like healthcare is being pulled in a million directions.
Yes.
It's not just AI, though.
What else?
The FDA is dealing with medical device shortages,
Oh, no.
and they're warning Sanofi about manufacturing violations.
That good?
These shortages affect real patients,
Right.
and the Sanofi warning shows how important quality control is.
Absolutely. Patient safety should be the priority.
For sure.
Good news, though.
What's that?
Eli Lilly is developing a weight loss pill.
Wow.
No needles.
Amazing for people who hate needles.
Yeah, it could really help people manage their weight.
We'll have to see how it goes through testing.
Right. Safety and effectiveness are key.
There's also
What?
a hospital in Virginia,
Yeah.
the first in the state to offer needle-free blood draws
Wow, so cool.
for inpatients.
That's awesome.
So many people hate needles.
I know.
This could really help them.
Yeah, less anxiety.
The American Cancer Society reports cancer mortality rates are declining,
That's great news.
but
Oh,
cancer incidence rates are increasing.
especially in women.
Yeah.
That's not good.
It's a weird paradox. We're treating cancer better, but more people are getting it.
We need more prevention and early detection then.
And Hilogic's Global Women's Health Index
Yeah.
shows a decline in cancer screenings,
For the first time ever.
especially for women. What do you make of this?
It's definitely alarming. Early detection is so important for many cancers.
Right.
Could be because of fear, lack of awareness, or limited access to health care.
We need to figure that out.
Yeah,
This all points to how important accessible and affordable healthcare is.
absolutely for everyone.
And a new study
What about it?
shows a widening gap in life expectancy in American
Hey, Sonar.
racial and ethnic groups.
This is a big problem.
Yeah.
Reflects inequalities in healthcare access and quality.
How do we fix it?
Address the social determinants of health, poverty, education, housing.
Big stuff.
Yeah.
On a more positive note,
What?
physician unions are gaining momentum.
That's interesting.
Multiple wins this week.
What's driving this?
Physicians are facing increasing workloads, burnout pressure from administrative tasks.
So unions give them a voice
Exactly.
to advocate for better working conditions,
And fair compensation.
hopefully leading to better patient care.
It seems like a sign of the times.
Yeah,
Healthcare workers demanding to be heard.
and it's not just in the U.S.
Right. A UK study found similar issues with general practitioners.
Burnout, mental health challenges.
We have to support our healthcare workers.
They're the backbone of the system.
Exactly. Especially with the pandemic still going on.
Yeah, their well-being is crucial.
We need to prevent burnout and ensure high-quality care.
Agreed. It's a global issue. The pandemic definitely made it worse, but the problems were already there.
Yeah, it's a good reminder that when we invest in healthcare workers, we're investing in the health of everyone, really.
Absolutely.
Okay, so let's zoom out a little.
Okay.
Look beyond the U.S.
All right.
The World Economic Forum
Yeah.
published a blueprint
What's it about?
tackling the global health gap for women.
Interesting. Tell me more.
So this report, it identifies 5 factors that are driving these disparities in women's health globally.
Okay, what are they?
It really emphasizes the need for better data collection and more research focused on women's health issues.
Okay.
And it talks about the need for care models that are both accessible and culturally sensitive.
So basic.
We haven't focused enough on women's health.
It sounds like it's been understudied and underfunded.
Exactly.
Yeah, we need a more inclusive approach to women's health care, for sure.
This actually connects back to what we were talking about with AI.
How so?
Could AI help close this global health gap for women?
It could. AI could analyze huge data sets and maybe find patterns that humans wouldn't see.
Right.
It could help personalize treatments, improve diagnoses, and even predict health risks for women. But we have to be careful.
Right.
We have to make sure AI benefits all women, not just some.
And we have to be mindful of biases in the data that's used to train these systems.
Exactly. We don't want to just recreate the same inequalities with technology.
That's a lot to consider.
It is.
It seems like a lot of the news today brings up ethical questions.
Yeah, about how we want technology to affect us and our health.
Yeah, and our future.
Exactly. And that's why these conversations are so important.
I agree.
We need to stay informed, ask the tough questions, and hold people accountable.
Especially the people who are developing and using these technologies.
Exactly.
So basically,
Right.
we need to become tech-savvy healthcare advocates.
I like that.
Let's go back to physician unions.
Okay.
How do you think this will change healthcare?
Well, I think physician unions will give healthcare workers a stronger voice to advocate for better working conditions
Okay.
and fair pay, which should hopefully lead to better care for patients.
Right, because like we said before, burnout and stress are huge problems.
Absolutely. And unions can help address those issues.
Maybe this will spread to other healthcare jobs too.
Yeah, that's possible.
Nurses, technicians, administrative staff.
They face a lot of the same pressures.
It's interesting to think about how this will be affected by AI too.
Yeah, if AI starts doing more tasks, will that give healthcare workers more or less power?
That's a big question.
It is, and it's one we'll have to deal with as AI becomes more common in healthcare.
We can't forget about the human element in all of this.
Absolutely.
This goes back to the needle-free blood draws.
Right.
It's a small change, but it could make a big difference.
For patients.
Yeah, it's all about improving their experience.
And showing that even small innovations can have a big impact.
Hopefully leading to better health for everyone.
Exactly.
Before we wrap up, I want to go back to the declining cancer screenings,
Okay.
especially for women. What can we do about this?
Well, first, we have to make cancer screenings more accessible and affordable.
Right. There's more than that.
It is. We also need to address the fear and misinformation that surrounds screenings.
Women need to have the right information so they can advocate for themselves,
Exactly. Public health campaigns can help.
like addressing concerns and debunking myths.
Yeah, and emphasizing early detection,
It's also important for healthcare providers to encourage screenings.
especially for people who don't have easy access to healthcare.
Okay, so we've talked about a lot,
Right.
from Trump being back in office
Right.
and the rise of AI in healthcare
Uh-huh.
to global health disparities.
Yeah, it's been a lot.
What do you think is the most important takeaway?
I think it's clear that politics, technology, and social change are all impacting healthcare.
In big ways.
Yeah, we're at a turning point.
And the choices we make now will affect the future of health.
Absolutely.
So what can we do?
Stay informed.
Okay.
think critically,
Yeah.
and advocate for the kind of healthcare system you want.
Don't just believe everything you read.
Right. Do your research ask questions, demand transparency?
We need to be informed and involved.
Exactly.
Well, that's about it for our deep dive into the news.
From January 22nd, 2025.
It was insightful and thought-provoking.
Definitely.
Maybe a little bit unsettling.
A lot to think about.
The future of healthcare is up to us.
I agree.
Thanks for joining us.
Yeah. See you next time.
Stay curious out there.